Okay, first question is, can you define euthanasia for me?
What does that mean?
Can you define euthanasia?
Is that when I gotta wait.
Euthanasia is assisted dying for the assistance of a physician or a healthcare professional.
Euthanasia is the practice of mercy killing or medically assisted death. Euthanasia is basically where a doctor assists a patient to kill themselves.
To me, it means mercy killing, where someone assists someone in dying because the person is in suffering or in the way.
Euthanasia is the active willingness to kill or put someone to sleep, and you're killing your dog, I guess.
How about in humans?
In humans, I don't know. It depends on who you are. Like if someone's in a coma for a while, it's kind of different from, you know, a hit and wham bang, you just don't like someone.
Euthanasia is putting people to sleep, putting animals, things to sleep, just because it's necessary.
By sleep you mean death?
By death, yes.
Euthanasia is when somebody is terminally ill and they want to die, and so doctors help them medically kill themselves, basically.
Merriam-Webster's Dictionary of Euthanasia is the act or practice of killing or permitting the death of a hopeless, sick, or injured individual, such as a person or domestic animal, in a relatively painless way for reasons of mercy. Physician-assisted suicide is defined as suicide by a patient facilitated by means as like a drug or information about how they might get a lethal dose of medicine provided by the physician, aware of the patient's intent. As voluntary act of euthanasia is when the patient requests for the physician to administer the medication, or involuntary act of euthanasia when the physician makes the decision, whether the person's in a coma or incompetent or incoherent or something, they make the decision and end the person's life. Also, withholding or withdrawing treatment could be the same thing as passive euthanasia, such as taking somebody off of life support or something like that, or taking out a feeding tube. Euthanasia, do you think it is something that should be allowed, or should it be outlawed?
Sure. I think it should. I mean, it's a person. I mean, a person's going to die, or they should just decide how they want to die.
I'm definitely against it, because I don't think no one has a right over another person's life. That's basically, you know, pretty much it. Simple.
I would not let somebody assist me in dying. Medically speaking, I will just try any other routes to live and then die naturally.
I think that euthanasia is wrong. By doing so, you're taking the role of God into human hands, and you really shouldn't be doing that. God's the one who decides when we are born, when we die. So I'm against it for the same reasons I'm against abortion. I mean, it's not. I mean, every life is precious. I am against it because I feel that a doctor should not take the decision of that patient's life into his own hands.
I really do not support euthanasia. I am in support of giving the person who is suffering as much help as is humanly possible. Sometimes medications are withheld, which could really relieve some of the suffering. I know that heavy doses of morphine and that can hasten the death, but at the same time, the person who is dying needs to be given as much relief as possible, and it's a very fine line to cross.
For or against euthanasia? I guess for. Why? Oh, because it sounds pretty? No, because sometimes the emotional stress caused to family members is different, because actually the whole thing about death and ceremonies is actually for the living, not for the dead, because life always moves on in a circle. So I guess it's better to help people pass into their next life, and rather than keep them here straggling along. I'm for it in a conditional sense. If someone is basically a vegetable that's being supported with oxygen and food, then they probably need euthanasia. But if they have a chance to survive, then no.
I'm for it because I think everybody has a right to life and has a right to decide what they want to do with their own lives.
I have the American Geriatric Society's position on this. They would say that it is morally acceptable for a physician to administer medication or forego treatment to improve the patient or the family's experience and to make it more pleasant as the end of life is coming. But they would say that the patient has to be informed of all the available options for them, and they have to be able to understand what's going on, and it's the physician's responsibility to tell them all those things. The fundamental goal of the doctor-patient relationship has been to comfort and to cure, and the physician's role is one that needs to comfort the patient. That's why they would say that it was okay to do anything possible to make it easier for the family and the individual. Point of view, we also have a book called the Palliative Care Nursing, Quality Care for the End of Life, that a lot of nurses go by. And it says that a person has the right to die, the right to refuse medical treatment, even when the refusal will cause death. I'm going to read the Hippocratic Oath that everyone that's going to become a doctor has to read before they can become an official doctor. Let's see. It specifically states in here, I will neither prescribe nor administer a lethal dose of medication to any patient, even if asked, nor counsel any such thing, nor perform the utmost respect for every human life, from fertilization to natural death, and reject abortion that deliberately takes a unique human life. So it specifically states in there that they would not do these things. So